Hi there. My name is Dr. Mark Donaldson, and I want to spend a few minutes talking to you about the benefits of Buffer Pro. In this module specifically, patient comfort and acceptance, faster local anesthetic onset, and more comfortable injections. So, you may or may not be familiar with the most recent data that shows dental fear still exists. Sure, back in 1998, when Dr. Ray Dion from Bethesda, Maryland at the National Institute of Health did his landmark study showing that greater than 50% of the general population self-reports as being fearful of going to the dentist, and in fact 15% self-reported as being terrified or very apprehensive. Dental fear still exists because you can see this most recent cover from the Journal of the American Dental Association, and the investigators finding that dental fear still exists, this time almost 73% amongst the general population, with almost 50% reporting moderate fear and another 25% reporting severe fear. So dental fear still exists, and why is that important as we bring it back to our topic at hand, local anesthesia? Well, interestingly enough, if you dive into the data, a recent survey showed that 58% of dental patients said the worst part of the dental visit is the injection. The injection scored worse than the drilling, the cost of the procedure, and everything else combined. So if we could just make the delivery of local anesthesia that much more painless for our patients, even make it a pleasant experience, we can certainly have a significant impact on dental fear and dental outcomes. Specifically, our patients complain about the pain during injection, a burning sensation immediately after injection, that lingering numbness that extends far beyond the dental appointment, the feeling of not being numb enough, excessive needle discomfort, and then on occasion swelling at the injection site, also known as a hematoma. So what does all of this have to do with buffering? Well, if I quickly take you back to high school science, you may remember that we have a system of pH in our bodies that on a unitless scale from 0 to 14 has neutral pH or physiological pH right in the middle, round about 7 to 7.4. The challenge with our local anesthetics is they tend to be stored in an acidic medium, and so to bring them up to their effective level, they need to get buffered. Now, typically the body will do this, but it's slow. So if we were to take our local anesthetic and add a buffering agent such as sodium bicarbonate, we can make the injection less painful, we can improve the effectiveness of the local anesthetic, but most importantly, we can make the appointment much more predictable. So some of you may be wondering, well, why do we keep local anesthetics at such an acidic pH? And part of the reason for that is to extend their shelf life. The best use dating for our local anesthetics is greatly extended when they are stored at an acidic environment. Also, with our local anesthetics, many of them contain a vasopressor, such as epinephrine. And epinephrine is soluble in water at low pH. It would be hard to get into solution if you stored your local anesthetic at a higher pH. So the bottom line here is that the average pH of local anesthetic solutions is quite acidic, round about 3.82. Ouch! When you inject that into the patient, it hurts. The body will typically take a few minutes to bring that acidic solution up to physiological pH, but it's slow. This is the reason why when dentists give you an injection, oftentimes they'll step out of the room and come back in a few minutes to ask how you're doing. So what if we could buffer our local anesthetic up front, inject into the patient a buffered solution that was already close to physiological pH? We would get rid of the ouch, and we would also accelerate the onset of the local anesthetic. Well, that's exactly what Buffer Pro does. And the question I often get is, buffering local anesthetic hard? Well, in fact, when we take a look at Buffer Pro, you can see that in less than 30 seconds, removing Buffer Pro from the envelope, taking your cartridge of local anesthetic, and simply connecting the two, you have buffered your local anesthetic. Much less painful local anesthesia, much faster onset, and certainly much more predictable dental appointments. My name is Dr. Mark Donaldson, and it's a pleasure to speak with you today.